Hi, it's Dr. Amanda from StraightSmileSolutions.com. Today we're going to be talking a little bit more about optimized attachments and attachment shapes with aligners. And I know this is a really confusing topic, so I wanted to make this video not only for doctors, but also for prospective patients and current patients of any type of aligner company, so you can understand what attachments are and what the different shapes are and what they do. And for the most part, I'm going to show you a demo. So hang on real quick and I will show you a demo. All right, so you can see here that this photo has a patient with many different attachments. Now, if you watch some of my other videos, you understand that there are different shapes of attachments. Like you can see here, this one has a rectangular vertical attachment. This one has some optimized attachments, which are some funky shapes, and there's two on this one, right? So there's lots of different shapes and sizes. Different brands have different shapes. So let's go into that a little bit more. So Align technology has been around since 1997. They've been doing attachments. Initially, their attachments were all pretty much rectangular and square, but since then they created something called optimized attachments, which are basically their branded word for we own these attachments and these shapes and no one else can have them. Are they better? I don't know. They think they are. I don't think it really makes a difference. As an orthodontist, I've done thousands of cases. I see no difference between their funky optimized proprietary attachments and regular rectangular and square attachments. However, for me, an attachment is an attachment, a handle is a handle. Yes, I can use rectangular and square attachments and ovoid attachments with other brands that aren't necessarily Align technology, and they work just as well for me. So to me, it doesn't make any difference. Other orthodontists might report something different. Yes, mine might be a little bit bigger, but they work just as well. And sometimes they're easier to put on, actually, and take off than these kind of funky shapes. And sometimes the funky shaped ones can be a little more uncomfortable because they have some really weird edges that can be really uncomfortable when you're not wearing your aligner. But to be honest, you're supposed to be wearing your aligner 22 hours a day anyways, and it won't be bothering you as long as your aligner is in. So for that reason, that shouldn't be a reason not to do it. But I wouldn't get too hung up on the whole optimized attachments and the shapes or anything like that. Remember, attachments are just a handle. That's all they are. They're a handle to help grab that tooth and do what you need it to do. So if the tooth is really round or flat or small, you're gonna need a handle. If the material, the more flexible and comfortable your aligner material, the thermoplastic material that your aligner is made of, the more you're gonna need an attachment, unfortunately. Let me show you a little bit more. Let's go back to my picture here. So you can see that this patient has a scallop trim line on their aligner. There are all different trim lines. There are scalloped, semi-scalloped, and straight line trim. This brand is clearly Align technology because there's optimized attachments, right? And they have a very scalloped trim. This is a very comfortable, healthy, low force aligner. Don't get me wrong, it's a great aligner, but the problem with it is you need lots of attachments. So on average, I would say the average cases I see are somewhere between 12 and 20 attachments on the whole arch. It's a lot. Some teeth have 2, some teeth have none. Obviously, the more crowded they are, the more attachments you're gonna need. The more you have high teeth, the more attachments you're gonna need because you're gonna need a handle. There are other aligner companies out there that use fewer attachments, but they also have a higher trim line or they use a thicker, more rigid plastic. The more rigid your plastic is, the higher the force levels are. So the benefit of that is that maybe you get more movement per aligner, but it can also be more uncomfortable, and the higher force points can cause more side effects, including discomfort. So many different things. Ultimately it's all gonna work, so don't get too hung up on it. And if attachments are done right, we're using the right material, they shouldn't stain at all. Absolutely not, as long as you're using a non-porous filled material. And they shouldn't be uncomfortable, and they really shouldn't be noticeable. And now in these days of 6 feet apart, I can't see attachments from 6 feet away. So I can see a trim line of an aligner if it's too low and your smile line's high, but I can't see the attachments from 6 feet away. And certainly not if you have a mask on, so I wouldn't stress out too much about the attachments. What really surprises me is when patients say, oh, I don't want attachments. Well, I think you're making a mistake. Now, there are some circumstances where you don't want to have an attachment. Let's say you're doing your treatment, you went off to the military, you went off to college, and you have a really simple, easy treatment. Just maybe you need a few more trays. So it's gonna cost you a little bit more if you don't get attachments, because it's going to take more trays to get from A to Z, than it would if you had an attachment. But then again, it might not cost more because you don't need that office visit to put them on and take them off. So I think it's something you could definitely haggle on a little bit and it might make the case a little less predictable. I feel very confident with attachments, but if I don't have attachments, I feel a little less confident, and I certainly don't guarantee outcomes in that case. So hopefully this was helpful, all about attachment, optimized attachments, and all that. If you have any questions, please feel free to post them in the comments section. And of course, you want to subscribe to my YouTube channel, slap that button, slap it. Awesome. We love it when you subscribe. We get super excited. We love your questions. And of course, if you're a doctor and you need help on a ClinCheck or a treatment plan, you can reach out to us through our website, StraightSmileSolutions.com. We would love to help you. We have really affordable rates. And some types of groups we do give free consulting to as well. So reach out to us. Maybe you're part of one of those groups. All right. Thanks so much.